so we've received an order for 4 milligrams of Zofran to give to our patient, Joe Schmo, from the provider. So we're going to verify the order against the MAR. Looks like for 4 milligrams of IV push Zofran. We pull out of the MAR. The vial has 2 milligrams per 1 milliliter. So we know that we're going to pull up 2 milliliters of that medication. We'll verify the medication against the MAR, the medication itself against the MAR as well. And then we will go ahead and in the med room we're going to pull up the medication. So we're going to do it by the 6 rights of medication as well. The right patient, right time, right dose, right medication, right route, and right documentation. So I'm going to go ahead and sanitize the top of this. Okay. And then I'll drop my air in here. You can also do this at the patient's bedside. I prefer to do it in the med room because then I have everything there that I need. So we're going to go ahead, because we're going to recap this needle, I'm going to set it on an alcohol swab. And we're going to stick that in there and inject our air. Okay. Comes right back into there. Kind of beat on it with a pen, get all those bubbles out. Okay. There's our 2 milliliters of medication. I'm going to use the scoop method here. And then I would label this with a piece of tape that says what the medication is, the patient's initials and birthday. So now I will take the medication vial and the patient in here, the medication vial and the medication in the syringe into the room, along with a saline flush and an alcohol wipe and some gloves, which I get in the room.
Hey.
Hey Joe, how we doing?
I'm doing good. How are you?
Oh, I'm doing good. So my name's Rita. I'm going to verify your name and birthday real fast, if you don't mind.
Okay, Joe Schmo, 3/22/78.
All right, Joe. So, little birdie told me that you've been feeling kind of nauseous lately.
Yeah, I just really feel like I've been gonna have to puke for quite a while now.
Yeah, I know that feeling. So, the provider has ordered you some medication. It's called Zofran. It's going to help with that nausea.
Oh, yeah, Zofran. I think I've had that before.
You have? Okay.
Yep.
Do you have any allergies to medications?
Nope, I do not.
Okay, good stuff. So, we're going to give this medication to you through what we call IV push. So I'm going to inject it right into this IV port here.
Oh, sure.
Gets into your system a little faster, so it'll help you feel better quicker, okay?
Okay.
Okay.
Like how quick?
Probably sometime, it depends on the patient. Some people feel it almost immediately within 2 to 5 minutes, and some people it takes up to 15 or 20 minutes, okay?
All right,
so we're looking at
sounds good.
anywhere between about 5 and 20 minutes.
Yeah, whatever will work to get this out of me.
Right? It works good. It's good stuff.
All
so,
right.
I'm going to scan your wristband, and I should have done this before, but I would have also checked my medication vial for cracks, discoloration, and make sure the expiration date was good. It is a single dose vial, so as soon as it's scanned into the MAR, it can be disposed of. So, all right, Joe, you ready to get this rocking and rolling?
I am. Anything to just feel better.
I know that feeling. So I'm going to just take a peek at your IV site here and make sure everything looks good. Okay, we're assessing for infiltration, phlebitis, redness, bleeding, anything not good. Have you been feeling any pain at that IV site?
No.
Okay, that's what I like to hear, Joe. So I'm going to go ahead and I am going to just kind of wipe the edge of this, keep it nice and clean. Okay. I gotta put that, remember that metallic-y stuff that tastes weird?
Yeah.
Yeah, I gotta inject about 5 milliliters of that beforehand, okay? Check my expiration date on that. It looks really good.
Fine.
I know it. I know nobody likes it. Oh, there's my pen. Make sure I get all my bubbles out of here. Okay. All right, Joe, you ready?
Yep, I'm good.
Okie doke. Okay, here we go. You tasting it yet?
Yep, there it is.
I know it. You're doing great. We're on the home stretch here.
Ugh.
I know it.
Hate that and sick feeling on top of nausea.
I know. Well, we're going to get you taken care of real quick, like.
Alright.
Okay. And I'll set this down on my alcohol pad. This is to maintain as much sterility as possible. Take my sharps off. We're going to go ahead and alcohol again. Always being sure. Keeping all those germs off. Alright, you ready, Joe? Here comes the med. So Zofran is a medication that you push at a rate of 2 milligrams per minute because we're giving, 2 milliliters per minute. So since we are giving the 2 milliliter dose, we will go ahead and time this at 2 minutes here, just as soon as the clock gets somewhere I like it. There we go. Okay, are you ready, Joe?
I am. What's gonna happen?
So you might feel a little bit dizzy. I gotta kind of keep you talking to me too because one of the adverse effects, it's kind of a worst case scenario, is deafness. So you have to, let me know if you can't hear me anymore.
All right.
Okay, and you might feel a little dizzy, might feel a little more nauseous.
All right.
Might feel like you're gonna vomit again.
Really hope I don't feel that.
I know, I'm pushing it nice and slow for you. It's gonna take me a whole minute to push this. So.
All right.
Still doing okay? You can hear me okay?
I am.
Okay.
I can hear you.
Are you hearing any ringing in your ears? That's another common side effect some people can have.
No, I'm not hearing that.
Good stuff. All right.
I think I might be starting to feel it a little.
Feel it how? What do you mean?
Well, I think my nausea's going away.
Oh, that's good. That's what we like to hear. Still doing okay?
Yeah, I'm doing good.
Good stuff. Is that nausea just kind of slowly going away?
Kinda, yeah. It's kind of holding, but it's going, and
Yeah.
I think it's getting better.
That's good. Okay, we're just about there, Joe.
Okay.
There we go. We did it.
Oh, that's it?
That's it. I'm
All right.
gonna go ahead and flush you again with this saline stuff you love so much, though.
Ugh, this thing
I
again.
know. It's just what it's gonna do is it's gonna make sure all the medication gets into your bloodstream, doesn't kind of hang out in this IV. Okay?
Well, I suppose that's the best thing.
I know. Ooh, just popped right on out of there. There we go. Okay, Joe, you ready?
Yeah, I'm ready.
Okay.
Oh, there it is again.
There's that taste again. I know it.
But I think my stomach's better.
Oh, that's good. That's what I like to hear.
Now, do I have to do this again?
Well, sometimes you have to flush just a certain amount of times a day just so we can keep that IV site nice and open.
Oh, okay.
Yeah. So it depends on what the provider ordered. I'd have to go and look in the computer and see what the provider ordered, how many times a day he wants it flushed. Usually it's like 3 or 4 times a day.
Now, do I have to get that what is that? Zofran stuff again?
Well, that depends. It depends on if your nausea goes away.
Oh, all right.
If your nausea goes away, you may not have to get it again. But if it doesn't, you may have to get it again. Okay?
Okay.
All right. How are you feeling, Joe?
I feel pretty good.
Okay, your IV site looks really good. That's what I like to hear. We didn't have any infiltration, any phlebitis or inflammation or anything not good going on in there. So, tell me how you're feeling.
I feel good.
You feel good?
I'm feeling like it's getting better.
Feeling like it's getting better? Okay, I'm going to come back and check on you in a couple minutes. Make sure you didn't have any allergic reaction or anything to it. Let's talk a little bit about that real fast, though. So, I want you to kind of keep an eye out for any allergic reactions or any what we call adverse reactions. So that deafness, that's an adverse reaction. So if you start thinking you can't hear, or when I come back in to assess you, we can probably further assess that. As for side effects, gotta watch for dizziness. Sometimes you can get a little bit of a headache with this medication. And then another adverse effect for that allergic reaction, we want to watch for any of that redness, itching, swelling, feeling like you can't breathe, itchy tongue, itchy throat, and itchy lips, okay?
All right, I can do that.
Okay, I'll let you get back to your TV show here.
Okay,
Lower
perfect.
the bed back down. Go ahead and make sure the side rails are up. Pull the curtain. Perform hand hygiene, and then we're going to document what medication we gave and what time we gave it, how we gave it, and we're going to document how the patient tolerated it. We'll document that we looked at his IV site, that it was patent both before and after. Saline flush of 5 milliliters was given before and after the medication administration. We'll document the state in which we left the patient in.